Here's a healthcare bombshell that's about to shake Minnesota to its core. Over 150,000 seniors are suddenly scrambling for new health insurance after UCare just pulled the plug on their Medicare Advantage plans. Imagine waking up one day to discover that your health insurance company has essentially said, "Thanks, but we're out." That's exactly what happened when UCare, commanding a hefty 26% slice of Minnesota's Medicare Advantage pie, announced they're completely abandoning this market come 2026. And here's where it gets controversial. This might just be the beginning of a domino effect that could reshape healthcare for Minnesota seniors forever. So what exactly is Medicare Advantage, and why should you care? Think of it as Medicare's privatized cousin. These are plans offered by private insurance companies, but bankrolled by Uncle Sam. They've become the darling of television commercials, with celebrity endorsements promising everything from dental coverage to gym memberships. The appeal is obvious. Who wouldn't want extra perks with their Medicare? But here's the part most people miss. The golden age of Medicare Advantage might be coming to a screeching halt. UCare's CEO, Hillary Martin-Resnick, didn't mince words when she admitted this was not made lightly. Translation? The numbers just don't add up anymore. The company is essentially telling 150,000 plus Minnesotans to find new healthcare coverage. And they're not alone in this exodus. The warning signs have been flashing red for months. Remember when a major health system suddenly dropped out of a Medicare Advantage network? Or when insurance behemoth United Healthcare announced plans to slash hundreds of thousands from their membership rolls? These weren't isolated incidents. They were canaries in the coal mine. And this is where the plot thickens. Kelly Jo Greiner, a healthcare policy analyst with the Minnesota Department of Human Services, dropped this bombshell on Friday. There are whispers of additional Medicare Advantage changes brewing across the state. We don't know anything definite at this time, Greiner cautioned, but this could be a real year of change for people in Minnesota, and they just need to keep their ears and eyes open to what's happening. So what's driving this mass exodus? The culprits are a perfect storm of financial pressures. Seniors are using healthcare services more than insurance companies anticipated. Imagine that! Meanwhile, federal payment rates have become what insurers diplomatically call unsustainably low, as healthcare costs skyrocket across the industry. In plain English, the math doesn't work anymore. But here's where the story gets even more intriguing. Blue Cross and Blue Shield of Minnesota, the state's Medicare Advantage heavyweight with roughly 200,000 enrollees, is playing their cards close to their chest. Their spokesperson essentially said, "We can't tell you what we're planning until October 1st because the feds won't let us." That's not exactly the reassuring message seniors want to hear, is it? Meanwhile, other players are stepping up to the plate, or at least claiming they will. Health Partners in Bloomington, covering more than 43,000 Minnesotans, promises they'll have Medicare options available. Medica from Minnetonka is not just staying in the game, but actively courting UCare's displaced customers. Their spokesperson practically rolled out the red carpet. For those who choose a Medica plan, our job will be to ensure that we are prepared to support their transition and provide them the coverage they need. But wait, there's more uncertainty on the horizon. United Health, covering about 94,000 Minnesotans with Medicare Advantage, has been ominously silent about their Minnesota-specific plans. Kentucky-based Humana has already announced cuts to Medicare Advantage options in various markets. The question that's keeping healthcare analysts awake at night: will Minnesota be spared, or are we looking at a complete market reshuffling? Greiner put it bluntly, "We don't know what that's going to look like in Minnesota. We're waiting to find out." That's government speak for buckle up, folks. To put this disruption in perspective, Greiner noted that she can't recall an insurer completely terminating their entire Medicare Advantage offering in Minnesota in recent memory. The last comparable chaos occurred in 2019 when Medicare cost plans ended, affecting 245,000 beneficiaries. Greiner described those plans as quasi-Medicare Advantage, fee-for-service type policies, and their termination created what she diplomatically called a lot of chaos. Here's what UCare customers need to know right now. And this is crucial. Because of UCare's exit, Affected enrollees get a special enrollment period that extends well beyond the typical October 15 to December 7th window. They have until February 28th to make their move. Sounds generous, right? But here's the catch that could leave thousands in healthcare limbo. If UCare customers don't actively choose a new plan before year's end, they'll automatically fall back into original Medicare Parts A and B. The problem: these basic plans don't cover prescription drugs. Imagine discovering in January that your medications are no longer covered because you missed a deadline. Even though they have additional time to make a decision, we don't want to see people left without coverage in January, Greiner emphasized. That's not just bureaucratic concern. That's a genuine warning about a potential healthcare catastrophe. So what are the alternatives? Here's where things get interesting. Displaced enrollees aren't just limited to shopping for other Medicare Advantage plans. They have access to what Tracy Keebler, executive director of nonprofit Start Senior Solutions, calls the Cadillac plans, Medigap policies. These Medigap plans work on a beautifully simple principle. You pay the premium, and then pretty much you don't pay anything else, Keebler explained. Most beneficiaries only get one shot at buying Medigap without health screening when they first enroll in Medicare Part B. But UCare's exit creates a special opportunity. Displaced customers can purchase Medigap without any health screening or policy limitations. But even this silver lining comes with clouds. Healthcare providers can drop out of plans mid-year, adding another layer of uncertainty. This year alone, Duluth-based Essentia Health abandoned Medicare Advantage networks at Humana, leaving patients scrambling to find new doctors or new plans. We want people to make sure their providers that they're currently seeing participate, but understand there may be changes down the road, Greiner warned. In other words, even after you pick a new plan, there's no guarantee your doctor will stick around. For UCare members feeling overwhelmed by these choices, there's help available. Minnesota Aging Pathways offers what Greiner describes as free, objective, unbiased assistance for people exploring their options. The key timeline to remember: while the special enrollment period extends to February, anyone wanting coverage starting January 1st must make their decision before December 31st. So here's the million-dollar question that's got everyone talking. Is this UCare exit an isolated corporate decision, or are we witnessing the beginning of Medicare Advantage's decline in Minnesota? Are we looking at a temporary market adjustment, or is this the start of a fundamental shift that will leave seniors with fewer, but possibly better healthcare options? What do you think? Should seniors be worried about this trend, or is this market correction exactly what healthcare needed? Are Medicare Advantage plans actually better than traditional Medicare? Or have we been sold a bill of goods wrapped in flashy TV commercials? And most importantly, if you were advising a Minnesota senior right now, what would you tell them to do?